sales tax would be nice for the next 6 months. Property tax, obviously, that'll be something that'll be looked at in the upcoming months when we start working on next year's budget. So, all those are the types of fees that are in your general fund. And I just want to mention this because I kind of sitting and thinking about it since the last meeting. The insolvency is the general fund. So, water sewer fund, although it's not in the greatest of shape, water sewer is not bankrupt. So. There are two different sets of books, two different sets of financial statements, and I just kind of want to remind people that's where we are. I mean, yes, the city's not doing well as a whole, but the water sewer is not in that as severe condition. Going on again with, this is another thing, this is just some more information again off of TML's website under surveys and publications. This is just go back later on to read. It's kind of interesting financial conditions for cities. Last year, 2012, their results they did from surveys. I'm just FYI. Anyway, going back to revenues. The other side of revenues on your water sewer fund was mentioned, kind of been mentioned. That's another area that we can increase fees, and we need to. It's been discussed the fact that the water rates are not correct in the system. I think that's been mentioned. I think the auditors made mention of that, and that will be an audit comment. So eventually, as we have another meeting with the auditors, once they complete the report, they'll have other additional things to look at. Hand this one around.
Is there a study being done on the water sewer rates?
Mm-hmm.
And when will that be?
The gentleman did, based on erroneous information, I guess you could say. So I'm going to be having to get him the corrected information. So hopefully. It won't be as long a lengthy process for that particular firm because they just got to change the numbers.
We've talked to Mr. Raul Gonzalez, and the issue is that he is trying to update the information on that end so he can present within the next 30 days. He's looking at completing that.
So the council should see a report in the next 30 days?
In the next 30 days.
From which firm?
It's Raul Gonzalez.
He's doing all for the fees and
Water,
all water and
wastewater.
rates.
water sewer rates.
It's part of the USDA. This one that I just handed out is the water fees. Again, the top piece came from TML again. They have on their page publications/surveys. And I just wanted to put this if you look at the very top, it has the different populations. It's average for 5,000, 10,000 on residential, commercial 50, 200. If you go down towards the bottom, you have Floresville, and you have per the billing system, and I've calculated based on their saying 5,000 or 10,000, and per ordinance on that particular rate. And that's been mentioned. The water rate's not as off quite as much. If you go over to commercial, you'll see the difference is $1. I also put down what the rates are that are in the system, and then based on the ordinance from 2009, and you can see. The first piece is first to third is 3,000 base rate, which is $13.50. For residential and commercial, they're the same rates. So you have 3,000 gallons, you pay $13.50. Then 3,000 to 12,000 is what the system has in it, but the ordinance says 10,000. So on 2,000 gallons is where a little bit of a loss is. So it's really only about $1, but it still is a loss. There's still something wrong, and I don't know why or when. I wasn't here in 2009. I don't know who entered this, I don't have any ideas. I know it needs to be corrected. When I hand out the wastewater, you'll see a little bit difference. But again, correcting it, we're not overcharging customers, we're undercharging. Do we fix it right this minute and then go back when the rate study comes back and make another change? That's going to be council decision. So something that the audit committee might recommend too, if y'all want to say fix it now and then change it again, that's going to be something
What is involved in fixing it?
just changing the rates.
So from a time perspective, it's just
10 minutes.
10 minutes.
Customer questions and things of that nature, but it would.
When did we discover this discrepancy?
I guess it would have been the middle of December when I was trying to work on some information.
And we have not updated the system to reflect the current ordinance?
No, I did not just arbitrarily make that change.
But we have the ordinance in place, correct?
Yes.
So why why would it take council action to
I
update the
think-
rates to reflect an ordinance that was passed in 2009?
I think
Because the
council
issue
needs
is,
to be aware.
yeah, we need to make sure that the council is aware, because if somebody's bill changes and they wanna know why the change was made, the council needs to be aware of that before we move forward and take that action.
Well, I agree that the council needs to be aware of it, but I don't think that it requires council action to, implement a change in the system that the ordinance already reflects.
Well, again,
You
that's.
know, if we've been
that's-
undercharging customers for 4 years, okay, great, you got away with it. Okay, this is a simple advice to council. This isn't a council action requirement.
Okay, we'll have to make more
Oh,
copies. She doesn't have enough.
And I'll tell you, it appears that it's been more than 4 years. The rates from 2005, the ordinance refers to ordinance 220. Those don't match either. So I'm not sure where the rates came that are in the system. So it's not even from, they're not even a holdover from an old rate.
Let me ask
Just-
one other question about this.
and then-
A guesstimate number, I mean, you give me you give us the per gallon rate here and the difference in the commercial rate. What total are we looking at in lost revenue?
I can't give you that without going back and recreating all of this. I don't have, now that the rate study may help us a little bit when he puts in the right numbers to kind of get an idea, but without when he's going back and recalculating all the bills, I couldn't tell you.
Is this committee
Now
having
this-
power to exchange it?
Yeah.
All we do is make recommendations.
And I just handed out now, we're handing out, this is the wastewater one, and this is the one that the difference is quite larger. So if you look, when you look down there, the tier is different as well in the system. The, in the system, part of it in the system appears maybe it's a typo, that they didn't realize putting the leading zero made that be 5 cents versus 50, and 7.5 cents versus 75, that should be.
Has that been circulated?
The wastewater.
Wastewater.
It's this one.
Sorry.
Yeah, I'll continue on from the table, kind of wastewater.
Nobody else is. I need Shoot.
What population are we looking at?
We are in the 5 to 10, I believe it's around 7,000 is the last, excuse me, 5,000.
Customers? Sewer and
No,
water customers?
Population.
Okay, but how many sewer and water customers do we have?
I'd have to get exact, and I think it was right under 3,000. I don't have the exact number. You'll see the base, like I said, on the commercial column, you'll see for commercial business that's using 2,000 gallons, we're losing about, 200,000 gallons, we're losing about $91 a month. And again, without recalculating all the bills, auditors pulled one for Walmart.
And you
It's
said that
almost $300 because they use way more than 200,000, so
This
it's,
discrepancy goes back to pre-2008, you're saying, for both water and sewer?
For 2009, for sure.
the system, y'all went in, started using Encode in '08, so I can't tell prior to '08. I know the ordinance from '05 does not match these rates.
It's lower or higher?
It's lower,
It's lower.
that's lower, because
So
you had an increase in '09.
So we've been undercharging customers based on what's in the system since 2008.
It's really curious. Again, I don't have the history, and I can't just tell my machine to give me a number, it doesn't, I
No,
don't.
but based on the rates that you have from 2005 and the rates you have from the ordinance in 2009, the city has been undercharging customers for both water and sewer service since 2008 when the Encode system was put in.
Here's two.
That's as far as you can research back.
So that, again, and that's, one of the things is, we talked, the auditor said insolvency plan, one of the things that is fees, correcting fees or increasing fees per the necessity based on studies or just, and some of those will be to professionals, some may be done, such as the 4A committee working on helping, that was one of the things I think they've been tasked with, helping on the fees that are in charge of the civic center, those types of things, and being able to come back to council with the ordinances, so.
What is the staff recommendation regarding fees, the rate discrepancy?
We had discussed it several times on do we make the move after the rate study's complete and then just do one instead of correcting what was deficient, and then coming back with the rate study and increasing that again. That was one of the issues that we had talked about. Our recommendation was if we can get this study done and presented to council within the next 30 days, that we move in that way.
It
Take one
seems to
step
me that it
forward.
would be less disruptive to the customer for us to wait until after the rate study.
Because we know the rate study is gonna show a need for an increase, so.
Well, if you're gonna get a hard hit at the end of the rate study rather than a softer, if we do two hits at it.
Sure. One of the things on the rate study that the gentleman has proposed, originally, now, once he corrects the study that he's done, is that we gradually increase to where we need to be or where we should have been. And one of the other things is that the tier system works out better to make sure that the average consumer doesn't take a hit. It'll be more so that the ones that utilize that service more.
When you say gradually, Andy, is that like several times during a year?
It'll be one time per year, until we get to where we need to be. And it'll be an upfront presentation to say, this is what we discovered, this is what it takes. Because a rate study only focuses on the current system that we have and what it takes to operate that. We know that impact studies will do the rest for any additional new construction.
I've seen them that way.
My opinion on this, for what it's worth, obviously this is just my opinion, if we have been undercharging customers since 2005 or since 2008 in the water and sewer bills, and we have ordinances that date back to 2009 that says this is what we should be charging, the implementation of that should not be delayed, and we can simply add a slip into a water bill that says that the rate study, when presented in 30 days, is going to also come with a lot of discussion by council and potentially some public hearing pieces and public information pieces. Delaying this for another 60 days is robbing the city of revenue that should have been in place.
Are there any Texas Commission on Environmental Quality or other statutes that has prohibitions on how many times a year?
No, we don't fall under those.
We're self-governed, so TCEQ doesn't have that power over the city.
I'm going to simply make note of this as one possible recommendation to council. We'll come back and discuss this after the city manager's made his full presentation and make and discuss it as a group and decide which direction we want to go.
Before we move on, I'd like to ask the people that are like on Social Security only, that are just so strapped for money, will there be some allowances for them where they're not just, people that live on Social Security and things like that, they're living hand to mouth. And all dollars matter.
Yes, ma'am.
Can I, excuse me, Andy? I think when the rate study comes in, those types of questions can be addressed as when we talk about the tier system. I think what we have, without seeing that study, we're simply speculating on what it's going to be, and we're only hearing bits and pieces of the information. And that's certainly something that this committee isn't going to have an impact on. That rate study would be presented to the council as a whole. So I think I would like to skip going over the rate study, other than the fact that it is ongoing and the council would see it in the next 30 days and focus on the recommendations that this committee can make.
Well, I wanted to point it out so the old folks in town don't go, they're being thought of.
And I think some of the other council members in the audience have voiced that concern for some time.
Do we have a problem with delinquent bills?
Not any more than other cities, yes. It's a norm. Okay,
That's another area of fees. We don't have a company that does delinquent collections that we send them off to. That is something else we could consider.
I can do that.
We have several companies that do that. Has to be bid out.
I know.
we have already addressed just the revenue end of it, because I believe you made mention, we are gonna discuss the expenditures and curbing that. We also have to address any revenue sources that we can tap into to move our city forward. So that was a basis on the revenue end of it. On the expenditure, or cutting back on the expenses to address this issue is what we'll address next. And with the handout, we had talked about the vacant positions that we had pretty much frozen from at least October the 1st on this budget cycle to leave open, and you've got a breakdown on the departments, streets. We have one equipment operator, and this will break down to annual salary. Laura did a tremendous job. Total annual salary, benefits, retirement, and at the end of the, off to the right, you have the total for that one position. We've got parks, and in our parks department, we've got the 4, their salaries, benefits, all the way to the end. Equipment operator, street department at the bottom right-hand corner is a total on that department. The parks, also at the bottom right of that category with the, under the 4, you've got the total on that we're saving. We just put in the pool, just so you could brainstorm or look at the options if we do not fill those seasonal positions and we do not open that pool, how much savings would be in the general fund total of $246,290 per year. Underneath, you've got the utility fund, which is our water and our wastewater, the 2 positions that we've got there, salary and benefits, and the cost savings of $124,653. The only thing that we have to keep in mind is that we are trying to address the shortfall in the general fund, so the top portion, streets, parks, and pool would only affect that area. The water, cutting back on the water side of those positions on the 124,000 would only increase or assist the reserves in that area.
These are positions
that are currently vacant. Yes, sir.
They're vacant?
Except for the pool position.
Yes, except for the pool
That,
portion of
like
it.
the parks director and so forth is empty?
Yes, ma'am.
On the pool, and does that mean shutting it down for the summer? or
Not
what?
opening, yes, not opening. That's an option, and that's just something that we had talked about.
So, all of these salaries are not, there's nobody.
Currently, they're not being filled.
How long are these positions been vacant?
Some have been vacant since last year. The Parks Director, we know she left at the beginning of this fiscal cycle.
Okay.
And the 2 labor positions under the parks are budgeted, but have never been filled.
And the manager at the Civic Center, her pay comes out of one of these?
No, she's totally on the, these are just the vacant ones that we got.
I see.
But she is funded through the Parks Department.
And let me clarify what he's saying a little bit. There's 7 positions, or total 7 positions that are currently in the budget, okay, in this fiscal year. If those 5 positions, as they relate to streets and parks, are not filled this fiscal year, there will be that savings of $105,000 plus or minus, or actually a little more, $205,000 plus or minus there. If we choose not to open the pool, and then therefore there would not be a requirement to fill 18 part-time swimming pool positions, there would be an additional savings of $30,000, getting to the total of $246,000. These are realized savings that we would see to the general fund this fiscal year.
How much is it brought in from the pool?
We, every year, sir, it either breaks even or loses some money. It's always been a quality of life issue that we call it.
And that's including the employees and stuff like that?
This would just include the employees, because we still have to maintain that full year round as far as chemicals. Yes.
So there would be no savings in maintenance or operations of the pool. The simple savings would be on the employees.
Correct.
don't you gain, because they don't make that much, do they?
Well, it's about 30,000, almost $31,000 in savings with those 18 pool positions.
So that's the position end of it. One of the other tasks or suggestions that were presented to staff were for us to look at the benefits end and what we could cut back on the benefits end of the employees. And Laura, I'll let you handle it.
This one I'm gonna pass this around. So it shows you the health insurance and a recap. And then also hand out this, so we can talk about it.
Are there any of these positions that are absolutely necessary, such as the wastewater foreman and water operator?
No.
Will it hinder anything if they did not get the?
No, one of the things that we did talk about, at staff level was how we can combine the resources that we currently have. Because our water and our wastewater operators currently are separate, but they are cross-trained in both areas, so.
Certified?
Some, yes. So some could fill in and assist on both ends, and we've been working at making sure that they're certified in water and wastewater. The other end would be streets and parks, if we could combine those two departments to utilize the resources. And when I say combine, I mean just utilize the resources from one department to the other. Because we've had some employees in both departments that have been with the city a number of years and have actually worked in all the departments within the city. So if we need to, we can pull resources from those two sides. Shooting passes.
This is a recap for your health insurance, because that was something that was mentioned about benefits. This is the health insurance piece. There's a small life insurance policy. We do have life insurance, but the dollar amount is pretty insignificant. But the health insurance, we pay per employee $410.28. So in the general fund, we have 57 that we're covering currently. And I say current, this includes all of vacant positions. This recap includes if these were all filled, so I didn't break that out because it would be too confusing. So this is if we had every position filled for the general fund, this is what it'll pay. We also have 3 retirees that are on insurance currently. Our open enrollment is October 1st. If we wanted to make changes to the plan, which always occurs during
Who does insurance carry?
we're with Humana.
And who took that?
It came back through budgeting process and through.
Did we get the 3 bids we were supposed to get?
It's more than 3 bids, but yes,
Okay.
it's a little bit different different than, yeah. It has to go through they put it out to out in the market is what they call it. It's something a little bit different than
Tally
getting
Insurance
3
is our
bids.
current,
Yes.
is our provider.
They're a broker. is
They're a
what
broker.
they- and you could use, there are other brokers and the only ones I'll tell you, I just left a city, we had 62 employees, and ours was 411 something, so, and we had quite a few health issues, so kind of very similar, and we were with United, so the rates aren't, I know they
I
had,
want to go work for the city. It's really great.
Yeah, me too.
yeah. The deductible is $2,500 on this plan, and currently well, let me go back, sorry. The open enrollment starts October 1st. About midsummer, about May, we start going out, they go putting out to market. At that point, they'll come back with lots of different types of plans, whether it's higher deductibles, 80/20, 70/30. They usually have several options with each carrier. And that's when you start working on what the monthly amount would be, and you can negotiate and then, going forward. So currently, we're not gonna be able to really make any changes to the plan until October 1st, because next year's budget. But again, this is something every year cities look at. So the $2,500 deductible, currently the city here offers what they consider a health reimbursement arrangement. I handed that out. It shows SBS services on the piece of paper on the top. They handle this reimbursement portion so that the city's not involved in it. We don't get involved in employees' health claims. Basically, if someone, if they use $500 worth of their deductible, $2,000 worth gets reimbursed. So it doesn't include co-insurance or copay. So if you go to the hospital and have surgery, the $2,000, if you hit your deductible, have to pay for your deductible, $2,500. $2,000 will get reimbursed by the city. You turn all of your receipts in this SPS.
That comes out of city money.
Comes out of city money. The insurance company is getting me the actual number of how many people use it. It's not very large from the lady said she goes, but in theory, you could have 57 employees in the general fund that all go have surgeries or you know.
And the medical reimbursement plan, for what it's worth, is a partial self-insurance plan. It is not uncommon, okay, for an individual or for a corporation to buy a larger deductible for a reduced premium. They get the lower cost of the insurance, and they amortize out the difference, and they say, okay, based on claims for a healthy city or a healthy organization, this is a good plan, okay? When you have an unhealthy organization that has higher claim history, et cetera, this becomes a lot bigger liability to the city or to the organization. In talking with the folks at Tally Benefits when they recommended this plan, the claim history was not substantial enough, and that this sort of plan was a significant savings to the city. What we don't know going forward is, would it be wise to change this? And essentially what happens is when the city buys a $2,500 deductible, and the insurance provider says, okay, we're going to pay 100% after $2,500. And the city says, okay, employee, we're going to use a third party to administer it, but you really only have a $500 deductible, and we'll reimburse you any expenses between $500 and $2,500. Currently, the city or the plan reimburses at 100% beyond $500. Would it be more cost effective to reimburse at an 80-20 level at that $500? That's one of the savings that could be seen at new plan benefits coming in, and this is something that the city's going to have to seriously look at. What are the health insurance costs of providing these to the employees, and what options are available to us, and will those options either reduce our liability through self-insurance and or reduce premium costs?
And we're not, yeah, like I said, it's kind of a hybrid. We're really not self-insured, or that would be in the back of your books.
That's
it's a
part
kind
of
of,
self-insurance.
it's a little bit of an odd, because self-insured is ugly at cities.
Yeah, the city is only self-insuring $2,000 per
Yes.
employee,
Yeah.
so there is a limited liability.
So this is something, I mean, it is something every year you have to go through, re-rate.
One of the steps that we had taken in previous years was that the city did provide dental insurance also. That was cut sometime back, so.
How do we compare to other city entities such as Phelps and the county?
Our insurance, because of the small claims, we were able to obtain this price, and even though it is a high price, it's lower than the counties. I know for sure. I don't know what it is for Phelps.
I think what she was asking is how do we compare in the way of benefit programs compared to what county employees get, compared to what school employees get, compared to what Phelps employees get.
For example, yeah, how much does the employee pay here? It is zero, right?
Yes.
Now, this is just for the employee? or-
Yes, this is
Yes,
just
just employee. They cover family.
And with Phelps,
I do not know.
do we know?
Mhm.
They cover the employee, right?
Check out the employee.
They cover employees, right? And with the county, do they cover employees?
Yes. One of the things that we had, yes, I believe so. One of the things that we had,
Yeah.
What's it?
I worked for the wrong entity that for too long.
one of the things that we had talked about in previous years was possibly combining with the light company and the county to see if we could get a better rate with more employees, but that's as far as that.
I don't think for what it was worth, I don't think it was worth it because of
You're right.
the jobs and the technicalities of it.
Yeah, and that was one of the things was the difference in claims from agency to agency.
But nevertheless, there's nothing we can do about it right now until October.
Yeah,
Well,
but we can,
it'll be in May, they'll start working on it in May, so in June, July.
but we can include it in the plan to say this is this is where we are, possibly looking at cutting some more expenses.
They make employees pay $100 or, you know, there's different options.
Based on their salaries, is this really something that should be considered?
It's a question for the audit committee themselves. We've looked at, we want to make sure that the information was relayed to the employees. At this point in time, we're not looking at cutting the current workforce. What we're doing is not filling these positions that we got, was the initial onset. And I think that they understand that if we're able to maintain positions or maintain jobs, that it may come at a cost of benefits in one way or another.
Well, I think it's just very important for the citizens and the workers to know that this is temporary. That as soon as we get our head above water, that we'll start back up, the job, you know, change the insurance back, that, you know, jobs will start coming back once we get our feet back on the ground. I think it's important for that, to know that.
Just, how much did the insurance go up from last year?
What was it? The fund is not.
I think it's 11%.
11%.
So we're looking at something close to it, if not more, next year.
If we continue, yeah, we'll see what this new healthcare
Well, it's not gonna go down, that's for
issue,
sure.
no, of course not.
Yeah.
And we don't know what our experience has been on the medical reimbursement yet. Do we know what the deductible reimbursement?
Did
No,
they get you?
No, she was gonna get the SBS to get me the last 2 years.
Okay, so they've had a deductible reimbursement plan for more than just this fiscal year.
Oh, yeah, I believe it's, how many years?
Maybe 4 or 5 years.
Yeah, that history would be real important, you know, because from two perspectives. One, from a budgeting perspective, that, you know, if we're gonna have this potential liability, you know, we certainly don't want to budget to 100% of the potential liability, but we want to budget to, you know, some realistic expectations based on claim history.
And a piece of it is that Tom did take some of it into account, so.
Some of it, or
Not, like you said, not 100%, not 57 employees times 2,000.
right.
And do we have any potential retirees?
That's the other piece, yeah.
No,
Sorry.
sorry. Okay, go ahead.
Yeah, we do have 3 that
No,
are
no,
currently
she's
on.
talking about coming up. We've got some potentials, but nothing certain at this time. One of the issues that she wanted to raise is a big issue that could be or would be a cost savings to the city, is if we have in past, I don't know how many years, provided retiree insurance. No matter what age they are, if they retire, the city carries their insurance till they are of age to receive Social Security. So we currently have 3 that are still on there. Laura states that we legally don't think that we can take that back from them, but we can actually, for sure say anybody from this date forward will not receive, that'll be a benefit that we can
Well,
cut
that
back.
insurance they carry, would that be, like the 80% that, does the city carry the 80%, or is it the, what is the?
Are they getting the same
secondary?
benefits
Yeah,
as
they get the exact
the
same,
Yes,
exact
same benefits
same.
as
all.
There's no difference, yes.
Yeah, they're
And so
carrying
that would be
employees.
something, getting council
But once they
to
get
say no
Medicare.
more.
It's from retirement to age 65, right?
Okay,
Or
once you get
67.
Medicare at age 65, then to buy the supplement, so does that take the place of the supplementary insurance that covers the 20%?
No, I think what I understand it to be, and correct me if I'm wrong, is when there's only one insurance provider between retirement and Medicare eligibility, the city covers them.
That's
Once they become eligible for Medicare, the city's out of the business.
Okay.
So those people who are still being insured and they're retired, can they be grandfathered?
They'd have to, I
They
believe
have
they
to.
have to be, they're checking again, but I'm pretty sure that's what we could now, is something we could bring to
That's
council
one of the
to
things
make the
that,
changes in the personnel
Yeah,
policy.
that's one of the things that Jason Talley has had an issue getting more insurance companies to put in a bid for our city because of the retiree insurance
I
portion.
think that's so.
Well, because the claims history on that group, that population is significantly higher than that of the employees, so your cost is significantly more, particularly under the medical reimbursement.
And so but that is something we can make that change now fairly quickly without, we can just grandfather those people in, so that we don't have to continue.
Are there any more or other recommendations from staff?
Not at this time. We can see that, the immediate cost savings are not filling the positions that we have not filled.
I've got a question on your last subject.
Yes.
Under the CBA for the police, is that insurance carried according to their CBA? Or is that another policy that the city was doing to the other retirees?
I don't know.
Well, you were talking about if you were to stop it,
I
or
don't-
change it today, that you can do it
I
now.
don't believe
But I just
retirees
wondered,
are
did it-
covered.
It's not in the collective bargaining.
Okay.
All it.
Insurance, they have.
Yeah,
Not the
but
retirees.
not after retire, it's not written in.
And then, there was one, TMRS was something that was discussed, that's our retirement package. We did contact them to talk to them about participation, how it works. Cities, once you're in, you are in. You cannot remove yourself from participation. It's not that kind of retirement plan. Currently, the city's at a 2-to-1, match. You could possibly go to a 1-to-1 match. The gentleman doesn't recommend it, but it is an option. It would be something that would come to council, because all the plan that you are under TMRS is adopted by ordinance. We could look at that. They can do some actuarial benefit costing to figure out how that would affect our rate. When I say our, the city's portion that we paid on the employee. And it would go into effect January of 2014. That's the plan year for the way the TMRS works. It's on a calendar year.
So we don't know what that potential savings would be
No.
yet?
We have not gone that far.
Is there a cost to asking TMRS for what that, doing those actuarial numbers to?
Don't believe there's a cost. Time, I don't know how long or what that would take, but no, as far as I'm aware of, they don't charge. There are other pieces in the plans that we don't offer, different types of benefits that you could eliminate. Well, the one thing he did say was the COLAs, which is future retirees, and retirees are out there right now, the way the plan is, COLA, you get your
Cost of living
retirement, cost
adjustment.
of living adjustment happens on retirement benefits. That could be removed, but it would not be as significant, he did say. Changing the, our rate's not gonna change. The employees currently, we're at a 5%, so we pay in. And again, you're not going to get out of TMRS statutorily.
Before I go on, one of the things I noticed I missed was citizens input. I know we had several people here that are not part of the committee and not part of council. Is there any citizens comment to this group?
I have a question. Could you just clarify, Mr. President, the protocol for citizens input? Is it only at the time, I understand this to be an audit committee, is that correct?
That's correct.
What is the protocol for citizens input? Can it be any other time except for when you call it, or like to interject opinions or otherwise during the process of discussion?
Well, I mean, if we follow the council directive, citizens inputs at the beginning of the meeting for an unlimited, or up to 5 minutes per citizen. And then before any action is taken by the council, as per this, or by this committee, will follow the same protocol as would apply at a city council. However, I can tell you that since November, citizens input is encouraged at all of the meetings, and nobody has asked anybody, that suggested that it was inappropriate for them to comment at any time during the meeting. And I think as far as this committee goes, so long as it's not disruptive to the meeting, that sort of citizens comment would be encouraged.
Thanks. I just have a comment about going back to the city rates, just for transparency purposes. And I realize it may raise more questions from the public, but I think just for the purpose of transparency and people understanding what's going on, and me personally, I'd like to see whatever change needs to be as soon as you decide that that's what you wanna do. I'd rather see that than after the study comes through, and I'm not even, I'm not knowledgeable exactly what study you're doing, but from what the discussion was today, after that's done, if there needs to be additional rate increase, then I would like to see that. I would like to be able to see the difference in what the rates were instead of lumped together, which I think people will see as trying to be pulled together and one more thing hidden in there, and I just think that in the long run, it's better for the public to see.
Thank you. And to simplify on the rate study, and you know, what, from the city's perspective, we've got to look at two pieces when it comes to utility rates. What is the cost of providing the service to the city? If it costs us $13 to do, you know, sewer service for a residential customer, it makes no sense to charge that customer $12. But it also makes no sense to charge that customer $30. Okay? And can rates be, we have to look at one, what is the cost of providing that service? Two, look at what similar cities are doing and charging. What's a fair rate for that service? Is it appropriate for the city to be making a profit on providing sewer service? Absolutely. Okay, in the same way it would be appropriate for the city to make a small profit on a building permit fee. But again, that's one of those places where it doesn't make sense to charge $100 for a building permit fee when we spend $700 in engineering fees for that piece. So it is those two pieces, but then it adds the third piece of a tiered structure so that we can establish a base rate for the residential customer and then go to a higher rate for the customer that is using more sewer service or more water service. So that we're making up the difference, so that now we can take a service that, say, it costs us $13 to provide the sewer service. We can charge you $12.50 for that service. The difference is made up on the tiered end of it. So we are protecting those residential customers, and the majority of those customers that have fixed rates. One of the things that Deb Conley talked about was the Social Security piece. But that's what I understand this rate study to come back to the city with recommendations based on the cost of the service being provided, what are fair rates, what are other cities doing, and what's a good practice to do, and then make those recommendations to the council for adoption in ordinance. And I think that's probably most appropriate for the council instead of, as you suggested, simply what would appear to be a knee-jerk reaction, let's just raise the utility rates because we don't have enough money in the general fund, but rather on some science and some appropriateness to that.
And I'm not saying do a knee-jerk reaction.
No, but
I'm saying if there's going to be an increase because for 5, 6, 8, 10, 2 years, whatever, we haven't done it, as soon as you think we need to do it, let's do it, rather than lumping it into, once we do a study and see a tier, then we're going to do it for this purpose.
Well,
There are two different aspects.
I think there's two different pieces, there's two different problems. One, we have not been charging what our ordinance says we were going to charge. Okay? And what that ordinance says we should be charging is below the standard. It is below that cost of good being provided. Okay? So we are dependent upon that rate study to say what should we be charging. So there's one increase because of what we said we would have to do. And then there's potentially a second increase or maybe even a partial decrease for some customers. Okay? Because of the rate study. So there's two different pieces. Andy, I'm going to erase your board again. I'm sorry.
Okay.
Just write on the paper.
That's all I'm saying, they're two separate issues.
But you don't,
If you're gonna do.
don't just pour it all on me at one
That's all I'm
time.
saying.
That's all she's saying.
Yeah, you don't have to go through all that, but it's just real simple.
Sorry.
Separate things so we can see. That's all I'm saying.
Right. You just want to know where we're going.
Hope you intend on writing all that back, because I was looking at it.
Good. Andy took a picture of it. And if he lost it, he sent it to me already, so I can forward it to you.
Like when a decision's been made to raise it, to let the citizens know, okay, now we're gonna make a raise, this is not the end of it, there's more to come. Is that what you're meaning? That's what I'm hearing you say.
I see it as two different issues. We have a
Okay.
situation where we haven't charged for X number of years.
Okay,
If we're going to make a correction, make it. That's all I'm saying.
sure,
Make
okay.
it.
Oh, okay.
Whatever you wanna say to the customer, you know, to the customer because of whatever, but let them know why there's
You mean
an
like through
increase.
a newspaper article or something, or?
Even on the bill.
Yeah,
Just
but don't
say
say
it.
it.
I don't read
That's
that.
what-
People
that's what-
people need to know why there was an increase.
I think that's gonna be done regardless. I
The
mean,
next one,
just
then,
for,
after
like
a
you said,
study, if
transparency.
there's an increase or decrease, your bill reflects this because.
Oh, I
Two
see.
different issues, just separate them so that people can track what we're doing.
See, in my opinion, if I can comment on that, I would rather see it as a one-time, when we do the rate study, simply because the people are not gonna understand it. They're gonna look at it.
I would.
People say, let's raise your water rates. You know, and the same thing that she says, like the people who are in fixed income, they see two different hikes. What's that gonna be for them? They can't afford it to begin with. I think it would be a lot easier for us to explain on a one-time thing. Because we've been waiting, I mean, this has been going on since 2005, 2008. You know, what's another month? She's saying you can do it in 30 days. That was my point
Maria
earlier.
was looking at
You know,
that.
do the rate study and increase it, because people will get confused. They're gonna think you did the hike twice.
So you're going to explain what the hike was for?
Yes.
Divide it out, that the
Yes.
years increased by $1.30 because for 8 years we haven't done this and now we've done a study and we're going to increase it because you're using more water, so now here's another $2.50.
So we say
Do all
by,
that?
And rate increase.
so we say by mid-February,
30 days is what they're saying we could do it. What's the 30 days? I mean, how much money are we looking at that we would be saving in 30 days or making in 30 days?
30 days
Again, I
from
don't
today.
have that
Yeah.
number.
You
The
know,
base
just-
rate, the base rate is correct, it's a tiered portion of it.
Yeah.
Is that 2,000 gallons at $2?
It's very small on the water side, it's the wastewater side on commercial that's hurting us.
Have we always had tiered rates, or is that something? The system was never big enough. Oh.
They're tiered rates and, yeah.
The more you use, the more you save.
Okay, if we go back through some of the things that have been discussed,
$4.
as far as staff recommendations, there were fees, and there are assortment of those that we can address, some that are existing, and possibly some new fees that could generate some revenue. Am I correct? Okay. We talked about employees. The two recommendations from staff were the 5 positions that are currently unfilled and a question mark regarding the pool. I don't know if that was a staff recommendation or not. It was? Or
It's just a,
Just
something else that
information.
y'all, we
Just-
brainstormed, I thought, yeah, other people.
Okay.
that was kind
Just
of-
an FYI.
There's something.
We had the utility fees. Okay, and then we talked about benefits. I want to come back to what Ms. Wagner said, and I think what are the responsibilities of this committee. And let's look at it from a little bit bigger picture. If we go back to what she presented us, this one-page document on the 18th, she brought up several issues. She brought up the issue of monitoring, okay? And she cited a finding from the previous audit, excuse me. And I want to read that finding as it relates to this issue. It was finding number 2011, number 3, entitled Monitoring. This was presented to the council in May of last year. It said that city management and those charged with governance should monitor the city's financial position and how actual operations are comparing to the budget. Because the city did not have the fund structure in place, and because accounts were not routinely reconciled, this process did not occur in an effective manner. As a result, the city's general fund has a deficit fund balance of $166,385 at September 30, 2011. The city's response to that finding was monthly review of actual versus budgeted amounts is being implemented.
What was the date on that, please, Mr. President?
Chairman, and it was May. I don't have the exact, it was May 4th, I think, is when they presented it.
Of what year, though?
2011?
2012.
You said 11.
Yeah.
It was 2012, talking about fiscal year 11-12, it was the audit of 11-12.
Okay.
In her statement to this audit committee, she said, in 2011, finding number 2011-3 noted that the city's financial position was not being monitored and the general fund balance was a deficit. That is, liabilities exceeded assets. This has deteriorated even more in 2012 to a general fund deficit of $355,419. She goes on to say that this further deterioration is due to the legal and professional fees paid in 2012. I have a breakdown of those fees, but it still occurred as a monitoring issue. And her last statement in here is the city is insolvent. Then she goes on to say, the city also in the end of 2012 had a cash deficit of $384,661 with outstanding payables of $177,468, roughly $550,000.
And that's the general fund.
Right?
That's the general fund.
General fund cash deficit, right. So roughly $550,000. Then she goes on to say, in the next item, in FY 2016, the city will have a debt service payment of $1.7 million and change. Granted, there is an interlocal agreement with the 4A that calls for a reimbursement